Hi, this is Dr. Rogu from RBK Pediatrics. I'm here at the end of the month rotation with my student, Dr. Johnny, who you may have seen in the office. He's going to do a nice little presentation on what's with all these viruses that we're seeing in a pediatric setting. So thank you for being with us this month, Dr. Johnny. I hope you learned something. I'm sure you learned
Definitely.
something, or at least about this. So take it
All
away,
right, thanks,
sir.
Dr. Rogu. All right, so my presentation is what's with all these viruses. And the reason that we decided this topic is because we see it all day, every day in the clinic, and we thought it would be a good idea to kind of dive into some of the facts and differentiations between these viruses. So getting right into it, I started off with just describing what a virus is. A virus is basically a germ. It causes things like the common cold, bronchiolitis, tonsillitis, ear infections, the flu. There's tons of different viruses, hundreds. Um, and it's so common that on average, preschool children can get at least 6 colds per year. And it's common for children to have up to 12 viral illnesses per year in the first few years of life. So if you think about that, they can have another virus every single month. And sometimes parents in the clinic were saying, is it normal that, my kid just got better from a sickness and they seem sick again? And it just goes to show that they can be sick every single month with another virus. It's common for children to get sick from one virus shortly after getting better from a different one. So that's what we were just talking about. But as children get older, the frequency of catching viral illnesses usually reduces. Okay. So how do kids catch viruses? This is going to be a recurring theme throughout this presentation. But viruses spread from person to person in tiny droplets, either from the nose or the mouth, saliva, when you sneeze, if you have a runny nose, if you're coughing and you don't, properly cover your mouth or wash your hands after. They can also spread through vomit or feces, especially if someone has diarrhea. So if a kid has diarrhea, and that's another way that it can spread. Most viral illnesses are contagious before a person has any symptoms, so an infected child can spread the virus before feeling sick. So that sometimes leads to, a lot of spread in schools and things like that when they don't know they're sick, but it's getting spread amongst all the kids. The best way to fight germs and keep them from spreading is to make sure that the kids and the adults wash their hands well and often. And then, of course, if your child's sick, you want to keep them home to prevent that spread.
Dr. Johnny, you remember that child that we had that we were going over the respiratory viral panel, and she had 4 viruses, and the mother couldn't understand why? Yet you look at the child, he's laying down on the floor, licking the floor. Lo and behold, he probably picked it up off the floor.
I think they had like a little blankie too that they had in their mouth, like all that.
Yes.
So some other ways to reduce the chances of getting viruses or passing them on is not sharing cups or cutlery, encouraging to sneeze or cough into the child's elbow, and using tissues, which should be thrown into the garbage immediately after using them, and washing their hands after that. It's impossible to prevent your kid from catching viruses, but you can help keep their immune system in good shape by ensuring they have a well-balanced diet and plenty of sleep. And it's important to be up to date with your child's immunizations to prevent viruses such as measles, mumps, rubella, chickenpox. All right, so moving on. Oops. Okay, so what is a respiratory viral panel, or RVP? So sometimes when we're in the office and the kid seems to have some kind of viral illness, we'll run an RVP. And that's, as you can see in the picture, when they put a little swab. This one's a little deeper than your classic COVID swab, but the kids definitely don't like it. But the purpose is it detects multiple pathogens, so your child's doctor can identify which one is causing the illness. While there's some variation among the panels, most RVPs test for the flu, RSV, adenovirus, parainfluenza virus, metapneumovirus, and rhinovirus, as well as COVID. So this presentation is going to go through each of those viruses. Okay, so we're going to start with the flu or influenza. All right. So these are some symptoms to look for to know if your child has the flu. Fever, cough, sore throat, runny or stuffy nose, muscle or body aches, headache, and fatigue or tiredness. And that again is going to recur throughout this presentation because a lot of those symptoms are present in a lot of these viruses. But it's also important to note that not everyone with the flu will have a fever. And some people could even have vomiting or diarrhea, but that's more common in children than adults. Okay, so talking about how it's spread again, most experts believe the flu is spread by droplets. On average, 8% of the US population gets sick from the flu each season. Children are most likely to get sick from the flu. The flu is most contagious in the first 3 to 4 days after the illness begins. Time between being exposed and infected with the flu to when the symptoms begin is about 2 days. And again, just to explain droplets are just the little fluids from coughing or sneezing or talking. They can land on people's mouths, noses that are nearby, as well as landing on surfaces that if you touch that surface later and then touch your eyes or your mouth or your nose, it can be transmitted that way. But the range of people who get sick is between 3 and 11%, depending on the season. With the flu, children younger than 18 are more than twice as likely to develop a symptomatic flu infection than adults 65 and older. However, some people can infect others as some people can infect others as early as 1 day before symptoms develop and up to 5 to 7 days after becoming sick. All right. All right, so diagnosis, treatment, and prevention. The flu is difficult to distinguish from other viruses and bacterial respiratory illnesses based on the symptoms alone, but the flu is included on the RVP, so when we get that test, we can identify the flu. The most important way to prevent the flu is to get the flu vaccine each year, and there are antiviral drugs that can treat the flu. In that picture, you see Tamiflu down there. And going back to the vaccine, the flu vaccine has been shown to reduce flu-related illnesses and the risk of serious flu complications that can result in hospitalizations or even death. Other ways to prevent the flu is staying away from people who are sick, covering coughs and sneezes, and frequently washing your hands. There are prescription medications like Tamiflu that fight against flu viruses in your body. They're different than antibiotics. They're not the same as an antibiotic that fight bacterial infections. And they do have to be prescribed by a physician, but they work best when they're started soon after the flu symptoms begin, and they can lessen the fever and shorten the time to get better. All right, so the next virus is RSV, or respiratory syncytial virus. It's a common virus that affects the lungs and the breathing passages. All right, so who's at greatest risk for RSV? Premature infants, infants, especially those 6 months and younger, children younger than 2 with chronic lung disease or congenital heart disease, children with weakened immune systems, children with neuromuscular disorders. And neuromuscular disorders include those with that cause difficulty swallowing or clearing mucus secretions. But virtually all children get RSV infection by the time they are 2 years old. But most of the time, it's just a mild cold-like illness.
If you remember in the office, we had little children with the RSV. We did the test and they were positive, and they had the difficulties, and sometimes we put them in the hospital. And it was always an older sibling that had a little bit of a runny nose cough that got the little one sick.
Yeah, we saw that a lot. That's kind of how it always progressed. All right, so moving on, the early symptoms of RSV to look for are, like we just said, that runny nose. You'll see decreased appetite, cough, wheezing, or difficulty breathing. And it's important to note that RSV may not be severe when it first starts, but it can become more severe, which is what some of the worry is that you see on the news and things like that. Although not common, it can progress and get more severe. And that cough can progress to a wheeze or a difficulty breathing. All right, so RSV in very young infants, you can see irritability, decreased activity, decreased appetite, and apnea. Apnea means pauses in breathing, more than 10 seconds. But infants who get RSV infection almost always show symptoms, whereas adults can have few or no symptoms. So, okay, and then the unfortunate cases that become severe RSV infections can lead to bronchiolitis, which is inflammation of the small airways of the lung, or pneumonia, which is infection of the lung. All right. So what to do if your child is at high risk? Some of those things that we were talking about earlier. Wash your hands often, keep your hands off your face, avoid close contact with sick people, cover your coughs and sneezes, clean and disinfect surfaces, stay home when you're sick. All the same stuff. Next virus is adenovirus. It's a group of common viruses, actually. It's a group, and they typically cause a mild flu or cold-like illness in people of all ages, but they're more common in babies and young children. There's many different types of adenovirus, so people can be infected more than once. All right, some general info about it. Most kids will have had at least one adenovirus infection before the age of 10. There are many different types of adenovirus, so people can get infected more than once. These viruses don't have a season like some of the other viruses, like when people say flu season or things like that. And they typically last from a few days to a week or two. Okay, so what illnesses do adenoviruses cause? The common cold, sore throat, pink eye, which is also known as conjunctivitis, acute bronchitis, which is some people know it as chest cold, pneumonia, and acute gastritis. And acute gastritis is just inflammation of the stomach or intestines, and it can cause things like diarrhea or vomiting. And bronchitis is basically inflammation of the lungs. And then less commonly, I have these two down here. Bladder infections and neurologic diseases are possible, but much less common. So what to look for, the symptoms again, we have eye redness and pain in the case of pink eye, diarrhea and vomiting in the case of gastritis, and belly pain goes along with that. Frequent peeing, burning, pain while peeing, or blood in the urine in the case of urinary tract infection, and headache as well. Okay, so how is adenovirus spread? It's just like the other viruses. It's especially contagious, common in close contact settings, spread through droplets again, coughs and sneezes, and also through fecal material. So those close contact settings are places like childcare centers, schools, hospitals, summer camps. So you'll hear a lot of kid that came home from camp or daycare or whatever, and it's common for them to have picked up a virus like adenovirus. And then the fecal material can be spread through contaminated water or dirty diapers or poor hand washing or touching contaminated toys, towels, and other objects. All right, so the treatment of adenovirus, this one does not have any antiviral medications, and as we said before, antibiotics won't help with viruses. So it's mostly symptomatic treatment. You want to get plenty of rest, drink a lot of fluids like Pedialyte and Gatorade, give acetaminophen or Tylenol if the fevers are uncomfortable, and then using a humidifier or saltwater nose drops can help with the congestion, but again, there's no specific treatment. Next virus is parainfluenza virus. It's a group of viruses that cause different types of respiratory infections and are most common in children and babies. All right, so some general info. There's 4 types of parainfluenza virus. They cause lower and upper respiratory infections. They're most known for croup because they're the most common cause. Um, they also can cause bronchiolitis, bronchitis, and certain types of pneumonia. All right, so the symptoms to look for, the common ones are fever, runny nose, cough, congestion, and then it's also possible to see sore throat, sneezing, wheezing, ear pain, irritability, and decreased appetite. Okay, so I mentioned that it's the most common cause of croup, so just explaining what croup is. Um, It's basically just an infection of the vocal cords, windpipe, and bronchi. So the vocal cords, also known as the larynx, cause laryngitis. The windpipe is also known as your trachea. And then the bronchi are located in your lungs, so it can infect all of those. All right, so the types of parainfluenza virus, this is not super important to know, but it's just a little extra information in case someone was curious. But types 1 and 2 both cause croup. Type 1 most often identified as the cause in children, but both cause upper and lower respiratory illnesses and colds. Type 3 is more often associated with bronchiolitis, bronchitis, and pneumonia, and type 4 is less common, but can cause mild to severe respiratory illness. Okay, so the spread, again, is going to be droplets in air, coughing, sneezing, close contact, touching surfaces where the germs have landed. The virus itself is most common in spring, summer, and fall. And of course, you want to wash your hands, avoid touching your eyes, nose, and mouth, and avoid close contact with sick people. Treatment, similar to adenovirus with no actual antiviral treatment, but you can symptomatically treat. So most kids will recover on their own, and the symptomatic relief can include Tylenol, ibuprofen, over-the-counter cough medicines. That'll help with the pain, the fever, and the cough. And then a room humidifier, or Dr. Rogu, I remember you suggesting to some people, having a hot shower with the steam to help their breathing.
Yeah. That helps.
And that'll help with the sore throat and the cough. And then, of course, you want to drink plenty of liquids, like we said, Gatorade, stay home and rest. Next virus, human metapneumovirus. It usually causes another mild cold-like symptoms, or it can even have no symptoms at all, but it can lead to serious problems like pneumonia in babies under 1 year old and in older people with heart and lung diseases. But almost everyone has been infected with metapneumovirus by the age of 5, and repeat infections in older children and adults are common and less severe. So the season for metapneumovirus is most common in the winter. It usually peaks a month or 2 after RSV peaks, which is another cold weather virus. Symptoms develop 3 to 5 days after being exposed, and duration of viral shedding is 1 to 2 weeks. So that's good to keep in mind when thinking about when to bring your kids back to school. So what to look for: cough, stuffy or runny nose, sore throat, fever. A baby or young child may feed poorly or act fussy, inactive, or sleepy. Serious infections can cause vomiting, diarrhea, and breathing problems. It's also, we saw a couple times, it can flare up asthma symptoms. So sometimes these kids that either have asthma or didn't know that they had asthma yet, it can really bother their asthma symptoms. So the spread, it's through direct contact with an infected person's saliva or nasal secretions. So again, droplets, surfaces, and the diagnosis is usually made clinically based on the symptoms, but it will also be included in that respiratory viral panel. Next is rhinovirus. This is the famous common cold, most common cause of the common cold. Many are mild, but they can sometimes lead to bronchiolitis and pneumonia, especially in babies. The season for rhinovirus is year-round, but it's most active during the winter. Symptoms usually start 4 to 5 days after exposure and infection from the virus, and kids usually are contagious for approximately 2 weeks. Okay, so what to look for, very similar to the others: runny nose, sneezing, sore throat, headache, cough, body aches. It can also lead to mild fever, ear infections, or sinus infections. And the spread is the same as the others, as we went over: droplets, surfaces, and through clinical tests like RVP. All right, so this is kind of a general wrap up of what we've been talking about, but what to do to prevent the spread of viruses. This applies to everything we talked about. You want to wash your hands often and well for at least 20 seconds. Have children do the same. Disinfect tables, toys, counters, and other surfaces regularly. Cover your sneezes and coughs. Don't touch your nose, mouth, or eyes, and prevent kids from doing the same. Use a tissue once, then throw it away and wash your hands. And then times to be concerned and when it makes the most sense to call your pediatrician. As we said, most kids will just get better on their own, but it's important to pay attention to any symptom your child or baby may have. Most cases are mild, but you should be on the lookout for more serious symptoms, such as a harsh barking cough like a seal that can signal croup, which is what we talked about with parainfluenza. Fast breathing more than 40 times per minute, or very difficult breathing, like retractions or using the stomach muscles when breathing. Signs of dehydration, like a dry mouth and eyes, little urine, and low energy, and a fever higher than 100.2 degrees Fahrenheit in an infant 3 months or younger, fever lasting longer than 3 days, and any other severe symptoms or symptoms lasting longer than 7 days are all good reasons to give your pediatrician a call. And that concludes my presentation.
Well, thank you, Dr. Johnny. I hope you learned something at RBK. These viruses are confusing to physicians, to students, and I can only imagine how confusing it is to
Absolutely.
parents.
Thank you so much.
So, that's why with the COVID epidemic and the flu and the RSV, all the parents, they don't know what to do.
It can get overwhelming.
It's
Yeah.
overwhelming. Yeah. Well, thank you for all your help. I hope
Thank
you learned
you so
something.
much.